Nupur, here we are.
Yes,
It's nice meeting you.
and you too.
And it's obviously great to be in Geneva around the World Health Assembly. And as you've probably seen, we talk a lot about leadership. What does leadership mean to you in this context? What's our purpose, really?
It's great to be here and chat with you. And I think that leadership from a lived experience point of view, and that's something I love talking about, is people living with NCDs. Taking charge of their
Yeah.
health. Being in a position where they can demand accountability, where they're enabled to seek the betterment of not just their own self, but also the communities that they live in. I think that's sort of what it resonates with me. But what about you?
Thank you. And it's great to hear from you because from my or our perspective as a pharmaceutical company, we really feel that's also our job
Right.
to lead and bring stakeholders together, like here at the World Health Assembly, and have a conversation connecting the various stakeholders, whether it's patients, physicians, policymakers, really all actors of an ecosystem, to think about, okay, what does it actually mean to make a difference for non-communicable diseases like cardiorenal metabolic diseases? What does it mean for us to make a change? Because we realize a lot has been done, a lot has been accomplished, but it's, in my mind, real leadership to step up and say, no, we can do more. There is so much more we want to achieve. It's a fact that 1 in 8 patients, so I think it's 1 billion patients are now living with cardiorenal metabolic diseases.
Right.
It's a huge economic burden. And then how do we really have lasting change? How do we have real action that makes a difference for the individual patient, but also for societies and the healthcare systems that they have? So
Yeah.
it's a tall order, I think, but it's worthwhile pursuing in my mind.
Right. It's really interesting, that you say that it really needs to be a multi-stakeholder effort because, that's true, isn't it? It's not just one set of, people that are going to make the change. It really requires a whole of society approach for the needle to move. And I think the challenge with NCDs, unlike communicable diseases or, other problems, is that they're chronic and lifelong and, for governments to step up. And I think one of the challenges I can think of, especially in low and middle income countries, in India and other places, the challenge is really about access and affordability, more than a lot of the other things that come later in the journey. But what do you think are, challenges or roadblocks that possibly could occur?
Yeah, I think it's a great point because it's actually obviously and honestly a complex challenge, right? And when you look at, I think there's some commonalities. For example, we see a lot more focus on treatment versus prevention. We see a lot of focus on the late stage of a patient. So take a kidney disease, right? The cost of dialysis is staggering. It's in the tens of thousands, if not hundreds of thousands. But we spend very little on education on kidney disease and how to prevent it, how to slow down the decline of the kidney early on. And so it's easy also to say as a single stakeholder, oh, this problem is too big for me alone, and to be quiet about it. But I think we have taken the opposite view to say, no, even though we only, as a pharmaceutical company, we provide treatments, we hopefully bring innovative treatments, but it is our duty, we feel, to connect the stakeholders here and shine a light on, well, how do we enable primary care physicians, for example, to have the conversation early on, to provide earlier diagnosis, rather than wait for the system to treat the very late stage or end stage of a disease.
Exactly.
And you could take kidney disease, you could take liver disease, you could take heart disease. No matter how you look at this complex of cardiorenal metabolic diseases, earlier is better, earlier education, earlier treatment. And that means really rethinking, reshaping how we think about diseases.
And this is such an important year, isn't it, with the UN high-level meeting coming up in September, and a lot of acceleration in terms of promises being made, and now with the zero draft out and all of the back and forth that's happening, what do you think the focus should be in terms of for member states or for any specific stakeholder that comes to mind?
First of all, I agree with you. It's a critical moment, to have the high-level meeting coming up, to have such a focus and spotlight shining on this topic. I would highlight really, we need to stop looking at individual diseases. We need to stop making individual plans, which is better than not having anything. But I would postulate, if we really want to make a difference, we look at it from an interconnected perspective. We cannot just look at cardiac or cardio metabolic diseases, but leave out the kidney, leave out the liver. And so once we have that view in my mind, this interconnected view, how do we enable the primary care physician to treat, to speak? And that also means, how do we provide the resources to primary care physicians to have an interconnected conversation, because they have 6-7 minutes for each patient, and then you need to go. It's very difficult.
It is
to have that holistic conversation.
And I'm really picking up on what you said about, not just focusing on one disease. And I think that's so crucial, because really there are, communities doing incredible work, civil society, private companies. But I think there's a lot of work happening in silos. And I think it really needs for us to come together, and kudos to you and to partners that bring all of these stakeholders together, because really it's not just a conversation, like you said, about one disease. It then ties into NCDs, which then ties into universal health coverage. So I think there's a lot of work to be done, not just up to September, but also beyond.
It's also people like us coming together and really having the courage to say, no, we need to have the connected, the integrated care discussion, right?
Exactly.
And that's what I look forward to, and that's why I think it's so great to have these conversations and really engage on what makes a difference.
That's right.
So Nupur, maybe the last question, what are your priorities now, and what's your call to action?
I think that for me now, with the zero draft that's just come out, we notice, as a community, that there is no mention of social participation, for example, and there needs to be more engagement with communities and people with lived experience, and not just have that as a good to do, like a tick mark on the box, but something that's more meaningful and helpful. And I think really the call to action would be, the time to act is now. It was actually yesterday, but let's grab the moment that we have.
So let's act now.
Yeah.
Absolutely agree. Very good. Pleasure meeting you.
And you too.
Thank you very much.
Thank you.